Well, the midterm elections are coming up tomorrow, and one topic of discussion is universal healthcare. But does this thing actually work? I've brought a very special guest to discuss the topic. What is up, everybody? This is Chris from The Rewired Soul, where we talk about the problem, but focus on the solution. And if you're new to my channel is all about mental health. So I make a ton of videos to try to help you improve your mental and emotional well-being, but I also try to help you be more aware of what's going on with mental health, especially when it comes to healthcare and all of that. So if you're into that, make sure to subscribe and ring that notification bell. So yeah, I have brought a very special guest, one of my very good YouTube buddies, Kay from the channel bipolarpug. I will be linking her channel up in the info cards and down in the description and in the pinned comments. She has an amazing, amazing, amazing mental health channel, so go check it out. Although, you know, her channel's called bipolarpug, she talks about all things mental health. But anyway, she is from the UK, so I was like, hey girl, like, we're having the midterm elections coming up, and something that's been a point of debate for years now is universal healthcare in the United States. So I wanted to ask her some questions about universal mental health care in the UK. So before I let Kay take it away, I just wanna talk about some things because, again, I just want you to go out and vote. If you're watching this video, you care about mental health care, like, go out and vote. Support whatever you think is best. I don't care who you vote for, but go vote. But on my channel, I just wanna kind of make you aware of some stuff going on in the United States when it comes to mental health care. So something to take into consideration is the Affordable Care Act, okay? So the Affordable Care Act is amazing. Like, there are some things that might need to be tweaked with it, but with the Affordable Care Act, they require insurance companies to cover mental health treatment as well as addiction recovery treatment. Now, depending on what insurance plan you have and how much they cover, that's a whole different story. But there's a lot of people who are trying to repeal the Affordable Care Act, but we need to realize that mental health care is part of that. So if that gets repealed, there's a chance that you'll have no mental health care at all. Now, something to take into consideration too is the out-of-pocket costs. Like me personally, I have had really good insurance for the past few years. Really, really good insurance, but even with that insurance, I still have a very large out-of-pocket cost. And like, for what I'm making and how much I'm already paying for insurance, I don't know about you, but for me, it doesn't always, you know, sometimes I can't even do it. Like, especially when it comes to physical health care, like I couldn't even go, you know, do my sleep study because it would have cost about $2,000 out of pocket. So I'm just trying to lose weight to work on my sleep apnea, you know what I'm saying? But anyways, we've talked about, you know, pricing and mental health care availability. So anyways, I just wanted Kay to talk a little bit about her experience with the mental health care system in the UK. She also works in mental health care treatment, so she's a perfect one to discuss this. So take it away, Kay.
Hello and welcome. So Chris has kindly asked me to guest on his channel to talk about universal healthcare. So I'm going to be talking about my experiences with the NHS. I'm sure you've heard of it. It's something that we have in the UK. I also work for the NHS, so I kind of have experience kind of being a service user, what they call it, or a patient, and working for the NHS in inpatient acute services. So yeah, if you don't know who I am, hi, my name is Kay. I'm also known as bipolarpug here on YouTube, and I make videos all about mental health, bipolar, but other stuff as well. So Chris has got some questions he wants me to answer about universal healthcare and what it's like. Is it any good? Yeah. So Chris says he basically only has 3 questions, which is good. Okay, so question number 1 is, how long does it take to see a therapist or psychologist? Now, this is a really tricky question because it really, really varies in the NHS. I've known people to wait over a year for psychological treatment. Some people have less, some people wait up to 4 years for psychological treatment in some of the extreme cases. And yeah, I feel like within the NHS, within adult services, it is quite difficult to get psychological therapies. And the kind of therapies that they focus on are kind of short form therapies like CBT, cognitive behavioural therapy, which can be really helpful for some, but sometimes they only offer 10 sessions. Sometimes they only offer phone calls within like the wellbeing service. Another psychological therapy that they offer is CAT therapy, which again is quite a short form therapy. Within child and adolescent mental health, I know they offer some more long form therapies because there's a lot of focus on early intervention. Family therapy is quite popular. But a lot of the times, the only things that they will offer is very short, structured forms of therapy no kind of long-term person-centered therapy. I tried to get therapy for quite a long time with my bipolar disorder. I've had CBT on the NHS, and I found that it was helpful, but it kind of didn't really address anything underneath the surface. So I actually went private, and I'm currently getting ACT therapy, which is acceptance and commitment therapy, and it has changed my world. Like, it's changed the way that I view my behaviors, my thoughts, my feelings, kind of being able to observe situations kind of outside of that sphere, rather than directly kind of acting on how I'm thinking and how I'm feeling. And I've been getting that therapy for over a year now, and I'm still getting that therapy, and that's not something that the NHS offer. However, it really depends sometimes on where you live, on what kind of therapies that you get and how long you get them for. So it's kind of tricky. I know a lot of the time for PTSD therapy and EMDR, which is the eye rapid motion, the one where you kind of relive traumatic experiences and kind of work through them. I don't think that's available in the NHS. Something that they're really quite hot on at the moment is DBT therapy. However, they don't offer that independently. They tend to offer something called a STEPS group, so that's a group program of DBT therapy, and a lot of people with, emotional dysregulation, EUPD, BPD, what they call it in America, have really responded to that. But one-to-one therapies within the NHS are quite hard to come by. Within the NHS, they try to do a lot of groups, so like psychoeducational kind of stuff, rather than one-to-one therapy a lot of the time. But someone else could come and say, look, I had a long form of therapy within the NHS, but that's not something that I really hear about a lot. So yeah, that was a very long-winded answer to that question, but I hope that's helpful. Okay, so number 2, what's the admissions process like for emergency mental health care? Again, I don't like to slag off the NHS, because the NHS is a really valuable thing, and without being hospitalised numerous times throughout the years because of my bipolar disorder, I would not be alive, or I wouldn't be able to afford treatment. I'd be in like ridiculous amounts of debt. So it has worked for me. However, the admissions process for emergency mental health care is really tricky. So the first point of call would be to go to A&E or the emergency room, and you'll wait in a really stressful environment for a really long time. One of my experiences is I waited 12 hours to be seen by a mental health professional, and they have something called the mental health liaison team, so they will decide whether people need to see crisis teams, which are amazing. It's an amazing thing that we have within the NHS, where people come to our homes every day and check in on us. It's almost like a hospital on wheels, where you have professionals come and chat to you and assess your risk. The thing is within the NHS is they try to promote the least restrictive interventions, so they don't like hospitalising people. You have to be very, 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 very unwell to be hospitalised. So the first port of call would be to go to the A&E, wait a really long time to be assessed. Sometimes they recommend hospitalisation, sometimes they detain people under the Mental Health Act, which basically means people can be treated in hospital against their will and they're deprived of their liberty. A lot of the time within adult mental health care, people go informally, especially people that have gone through, depression, suicidal stuff. It's not great, and it is used as a very last resort, people being treated in hospital within emergencies. I think a lot of the time with the NHS, there just isn't enough staff and resources to go around to help people that are in crisis. People do fall through the cracks and people do die. But again, on the other side of it, a lot of people are caught by that safety net, and a lot of people are supported by crisis teams, and they get them out of that crisis phase and they don't have to go to hospital, which is amazing because, if you think about it, if you were sectioned today, think about what you would lose, your home, maybe your pets, being able to see your friends and family. What about your job? So kind of promoting least restrictive interventions are really great, but yeah, it's not amazing, emergency mental health care, and I think it's the same anywhere, really. It's not something that we've really perfected. So yeah, that's kind of really how it works. Okay, so the final question is, oh boy, this is a zinger. Would you rather have America's healthcare system brackets, feel free to laugh your ass off when answering this. No. The short answer to this is no. Although I've had to go private to get my kind of therapy needs met, the NHS has met a lot of my emergency healthcare needs, being hospitalised, community psychiatric nurses, crisis teams, all that kind of stuff. I would be in so much debt, ridiculous amounts of debt for the amount of times that I've been hospitalised over the years. And yeah, the NHS is flawed, underfunded in a lot of ways, but it has provided a safety net for a lot of people that have been in crisis. It is not a completely holistic, rounded, care where everybody's needs are met, especially therapeutic needs, but it has saved a lot of lives, and I am very passionate about the NHS and I'm very protective about the NHS, but I'm also very aware that the NHS is very flawed and needs more money. Basically, it just needs more money. But so does the NHS as a whole. But yeah, sometimes I think mental health isn't as addressed as importantly as some of the other issues, but there is a service there, and yeah, I'm really passionate about it. And I think as time goes on, and especially within the last 10 years, mental health is more of a prevalent thing among a lot of people. And yeah, I think it's really important that we promote the least restrictive practices for people, so not putting people in hospital all the time unless they absolutely positively need it. However, we are failing a lot of people who are kind of slipping through the net, if that makes sense. So yeah, I hope that was helpful. My name is Kay, again, hi. I'm also known as bipolarpug here on YouTube. Please subscribe to me if you'd like to. I make regular videos on mental health. I'm very passionate about it. And yeah, I hope you like this little video. So yeah, take care. Bye.
All right, thank you so much, Kay, for sharing your experience with the UK's mental health care treatment out there. And yeah, again, I'm gonna link her all over the place and in the end card, so make sure you go subscribe to her. But anyways, there's a few things I wanna talk about. Like, I asked Kay a few specific questions because these are often, what people debate about, and, the long waits and all this. And yeah, it's true. Like, there are longer waits, but when I was talking to Kay after I watched her video and we were just DMing on Twitter, like, something that's important to realize is that even in the UK, they're allocating more money to physical healthcare than mental health care, right? So one of the reasons I have this channel, one of the reasons I try to get all of you to help spread awareness, is that we need to let people know, like, this is a big deal, right? And we also need to understand that there's a lot of medical conditions, like physical conditions that are triggered by mental health issues. For example, heart problems based on stress and anxiety. Other medical issues like more heart issues. I just know a lot of my heart issues were based on things like depression, anxiety, like I didn't care about eating well, I didn't care about exercising and all of that. So if we start putting more funding towards mental health care, you'll start to see physical health problems going down. Like when I was talking about in my video about universal basic income, like that's something that we need to realize, is that hospitalizations and health issues decrease as you start to treat mental health, right? Now, one argument that came up in the universal basic income video was, where are we gonna get the money? Where are we gonna get the money? And, I don't say my political affiliations or like which way I lean, but I think if you know me, you probably can guess. But I will say this, like, one of the weakest arguments out there is where we're gonna find the money for it. Like, if you look, I'm just throwing this out there, if you look at the amount of money we're spending on offensive wars in our military, especially compared to any other nation, like, what I always say is, like, nobody ever asks where the money's coming from when we decide to go to, do these offensive wars or put trillions of dollars into the military. Nobody even asks where that money's gonna come from. So I just want you to think about that when we're like, where's the money gonna come from, right? But the other thing that I wanna talk about is Kay was talking about the debt, right? Like, if she didn't have this type of mental health care, she'd be in massive amounts of debt. I don't know about you, but for me, being in massive amounts of debt or not being able to afford things can also trigger more anxiety and more depression. That's something to consider, okay? So she did talk about how there are some long waits. Sometimes it takes a while. Sometimes the emergency mental health care isn't the best. But I also want you to take into consideration that Kay also said she gets private mental health care. So by having universal health care, because one of the other arguments is that it would be taking away people's options, right? People wouldn't have options. But if you look at what the UK is doing, people still have the options. So if you don't want to do the, the government-funded route, you could still go see a private therapist or whatever it is and pay out of pocket. And I don't know how much this is converted, but Case stated that some therapists out there are about 150 pounds. But anyways, like, if you think about what a lot of people are paying for therapy sessions here in the United States with health insurance, it's almost as much. So just take that stuff in consideration, all right? So I just wanted to bring this topic up, and again, thank you, Kay, for coming over, but the midterms are November 6th, they're tomorrow, and even if you're watching this video afterwards, it's just stuff to think about, okay? If you care about mental health, you need to understand how who we elect affects our mental health, all right? But anyways, let me know down in the comments below, what are your thoughts about universal health care, mental health treatment? If you're from another country that has universal health care, like how much of this was similar to Kay's experience in the UK? Is it different in other places? Let us know down in the comments below, okay? Anyways, that's all I got for you with this video. If you like this video, please give it a thumbs up. If you're new, make sure to subscribe and ring that notification bell. And a huge thank you to everybody supporting the channel over on Patreon. And make sure you go subscribe to Kay at bipolarpug by clicking or tapping right there, all right? Thanks again so much for watching. Go out and vote, and I'll see you next time.